All right, welcome everyone. Welcome, welcome. We are very excited to have you here at our Her Speaker Series, which actually is our last of the month. We have had quite a number of education events this month, so we're very excited to be able to round out our speaking events and education series for the month with you tonight. So tonight we are joined by gynecologic oncologist Dr. Tommy Buchanan, who will be discussing why lymphedema happens with an ovarian cancer diagnosis, including risk factors. Then we'll hear from two physical therapists from Revital Cancer Rehab who will show us how PT can help soothe lymphedema and even reduce risk for developing it. So, as many of you know, our education events would not be possible without our education sponsors. So, our education events would not be possible without our sponsors today. So, we have our presenting sponsors, West, Merck, and Daiichi Sankyo, with supporting sponsors GSK, Lilly, Gilead, Pfizer, and Immunogen, which is now part of AbbVie. So, of course, thank you to our speaker series education sponsors for allowing these wonderful events and many similar events to happen like the one we have today. All right, so a little bit of housekeeping before we get too in depth. This is actually, like I mentioned, our second speaker series of the month. So hopefully you tuned into our Ask the Experts segment earlier today, also highlighting ovarian cancer and ADCs in ovarian cancer. My name is Aubrey Red, and I am a senior culinary dietitian here at Unite for Her. And I know that we're all very familiar with Zoom and housekeeping for Zoom, but I always like to just go over it anyway. If you can, please mute yourself. Just we can help you if you need assistance, but it helps with any background noise for our speakers and presenters. We'll start with our presentation by our first speaker, then we'll have some questions, move into our second speaker, and then time for questions at the end as well. You can raise your hand or you can put your questions in the chat. Myself and Rachel, my co-host, will be monitoring the chat today, and we will be recording this presentation. So that can be viewed from our Her library whenever you would like. So if you want to come back and take some notes on the presentation afterwards, be sure to check it out in all of our education events in our Her library. Speaking of education events, of course, this is the end of September, so we're getting ready for our October events. We'll be kicking off October with our Her Speaker Series next Thursday, October 3rd at 6 p.m. Eastern via Zoom. Erin will be joined by Ricky Fairley and Valerie Worthy from our partner Touch, the Black Breast Cancer Alliance, to share a new initiative called Touch Care, highlighting the power of nurse navigation in integrative oncology care. You can register for next week's speaker series via the Unite for Her website or our social media. And all of our past virtual events, like our Her Speaker series, are always available on our Her library, which is just www.uniteforher.org/her library. So I'll put that in the chat for everyone, but without further ado, I think it's time that we go ahead and introduce our first speaker. So we have today with us Dr. Tommy Buchanan, who is a gynecologist oncologist in Willow Grove, PA, with more than 12 years of experience, including extensive experience with gynecologic cancers. He graduated from St. George's University School of Medicine in 2011, and he is affiliated with both Jefferson Abington and Jefferson Lansdale hospitals. So please join me in welcoming our first guest, Dr. Tommy Buchanan.
Thank you so much, Aubrey. I really appreciate the opportunity to be able to speak with you all. I'm going to go ahead and share my screen now, if it's okay. I always have to do the obligatory, can you see this, before the presentation. So thank you all again for having me, and it's a pleasure to be able to talk about this subject. I'd like to start out by actually sharing with you some insights from a patient of mine, an actual patient. I won't give any descriptors to protect her anonymity, but some patient of mine operated on about 2 years ago for ovarian cancer. She had pretty extensive disease in the abdomen and pelvis that involved a lot of lymph nodes. During her surgery, I did have to remove all of those to get her cancer free at the time of surgery. She then went on to go to receive 6 cycles of chemotherapy, did very well with the treatment, and did pretty well overall. About a month after surgery, though, she did start developing some swelling in her feet. It was something that she kind of dismissed, but would bring up every once in a while. And we would see each other very frequently, of course, during the chemotherapy. So she'd bring it up every now and again, and I would check on it. And it actually gradually started getting a little worse and worse. It started in her feet, started moving up to her ankles, then her calves, and then pretty much all the way up to her knees. And eventually, it was something that we would talk about enough that we decided to do something about it. We prescribed her some physical therapy, which we'll hear more about, and we fitted her for some compression stockings. But this was prior to surgery and prior to her cancer diagnosis, a very active woman. She went on walks daily with her husband. She had several grandkids, loved playing with her grandkids, was very active, was a big shopper. She always was dressed really well. And she started noticing that these things in her life were being affected. She was not able to walk around much when she was shopping. She wasn't able to play with her grandkids as much. She wasn't able to walk as far with her husband anymore. And although we got her symptoms under control, these are things that significantly affected her quality of life. And something she said relatively recently, in the last few months, actually really struck me. We were going over some test results and we were going over a scan, and everything was great. She was still cancer free, and I showed her some results, and she gave a smile and she was happy. But we've known each other for a while, so I was kind of asked her, what's going on? Why aren't you happier about this the scan? And she said, it hit me recently that sometimes with this lymphedema, I feel like I've traded one disease for another. And when you have a diagnosis like ovarian cancer, that's something that really struck me. And it really just goes to show how this diagnosis can affect people's lives. And a lot of times we focus on the treatment, but sometimes we don't always focus on the result of that treatment. So let's start by identifying what actually is lymphedema. Let's go over some sort of definitions. Lymphedema can be applied to many different diseases, not just cancers, and certainly not just ovarian cancer. So lymphedema is just basically the swelling that's caused by a buildup of any lymphatic fluid in the body, or any fluid in general. And this commonly occurs as related to cancer when lymph nodes are damaged or removed during cancer treatment. It can also occur, and we'll go over some other causes, but it can also occur when cancer is involved in the lymph nodes. Some areas that are affected for our patients in particular with gynecologic cancer can be the feet and the legs, certainly, but also the abdomen and the pelvis, which is a lot of times overlooked, and sometimes more commonly the cause of ovarian cancer that's related to, lymphedema that's related to ovarian cancer rather than some of the other cancers that we see. So looking again at the impact, not just on the individual, but on patients as a whole. And there's some studies that show rates of up to 70% in select populations that are actually affected by lymphedema among cancers of any type. So this is a significant problem, not just with our cancers, but with many types of cancers. And specifically with ovarian cancer, about 1 out of every 5 women with ovarian cancer reported lymphedema to some degree, whether that's a severe form or just a mild form. So this is extremely significant. And it obviously affects quality of life, as we talked about before. Over a quarter actually report a financial burden, something we don't often think of. These are often related to the treatments for lymphedema, but this could also be missing work, missing functions, having to have things delivered or done for them. And this is a significant thing as well. Over half of our patients also report alterations in their daily activities. So again, this could be things we do for fun, but this could also be going to the grocery store. This could be doing things around the house. So the impact is extremely significant, and the studies and the numbers reflect that as well. And then looking back at the individual, having any chronic problem, especially one that is so noticeable, especially to the patients themselves, this can often cause depression, anxiety, and a negative body image. You're sort of reminded of this cancer, and especially of the treatment every time you look in the mirror and you look at the swelling that's involved. So this is a real issue. So backing up a little bit more, we're going to talk about how the actual lymphatic system works, and what lymph nodes are. We hear the term lymph nodes thrown around a lot, but we don't often know or go into what they actually do. So the lymphatic system is technically part of the immune system, and it's kind of like the term denotes. It's a system of lymph nodes and specifically lymph vessels. And these are similar to blood vessels. They connect lymph nodes, and they are scattered all throughout your body. You have hundreds of lymph nodes that are basically from head to toe in your body. A lot of times they follow the same pattern as blood vessels, and they're linked to each other through this system of lymphatic vessels. And I have a picture on the next slide to show you. But their function is the function of the lymphatic system as a whole is to essentially remove waste and excess fluid and distribute fluid throughout the body. And then it also serves to remove any toxic material that is found anywhere else in the body, and deposit that through the lymphatic channels and into the blood vessels, so that then they can be removed from the body, and either through the urine or the stool. Lymph nodes then act also as filters and can then trap any harmful substances or any unwanted pathogens in the body as well. And this is the connection between our immune system and the pathogens themselves. This is sort of the battleground where a lot of this takes place. So looking at this picture on the left, we can see this distribution of the lymphatic system. The little dots in green here are common sites of lymph nodes, although the actual location of lymph nodes in the body are not specific or not exact in every person. We do have a little bit of variation, but the green lymph vessels are the sort of the highway system between the lymph nodes that I was discussing further. And it looks like a similar diagram of what you would see looking at the circulatory system. That's because it actually commonly follows circulation. As you see on the right, this is the interaction between a lymph system and the actual blood vessels. So in the green, we see this lymph node. It has a system of lymph vessels that then interacts with arteries and veins and capillaries to exchange fluid, materials, et cetera. And it follows the same sort of pathway. So what is the actual cause of lymphedema? So for ovarian cancer in particular, this often happens when women undergo surgery to remove lymph nodes. So in the picture we see on the right here is a cartoon diagram, but a very representative picture of what we see when we operate on ovarian cancer. So cancer starts in the ovaries, but it tends to spread in kind of a direct distribution, as we see here, and it can kind of coat different organs in the abdomen and the pelvis. And that includes oftentimes the lymphatics and the lymph nodes in the pelvis and in the abdomen. So removing the cancer often involves removing these lymph nodes, and it's very difficult and sometimes impossible to avoid these lymph nodes. And certainly our goal of surgery is to remove all of the cancer that we can visibly see in the body. And a lot of times that involves removing cancer that's also in a lymph node. So it's unfortunately in most cases unavoidable when there's lymph nodes that are involved with cancer. Although we don't use a lot of radiation for ovarian cancer, radiation can actually damage nodes and vessels directly, somewhat similar to surgery. Again, radiation is not a common modality in treatment, but we do use it sometimes. And sometimes we have patients who've had radiation for other reasons in the past, and those can certainly be risk factors for developing lymphedema in the future. Chemotherapy is often what we give after surgery for ovarian cancer. And although chemotherapy doesn't directly damage lymph nodes or the lymphatic system, can sometimes reduce the immune system to the point of causing a widespread infection. So any kind of infection can increase the risk of lymphedema. Also, scar tissue from surgery can affect the function of these lymphatic channels. And then, prior to surgery or sometimes after surgery in instances of recurrence, we can actually have these tumor masses that are actually blocking these lymphatic vessels. So basically, any disruption of this natural flow of fluid through the lymphatic system can cause a buildup and then cause either swelling in the legs, the abdomen, pelvis. And then, of course, removing lymph nodes, removing lymphatic vessels unfortunately, doesn't allow for as free of a flow from the fluid throughout the body back into the blood vessels. So that's what actually causes the buildup of fluid. So, how can we recognize lymphedema? Well, often it's just a persistent swelling in the legs, abdomen, or pelvis, specifically for ovarian cancer patients. Different types of cancers affect different parts of the body, of course, but in ovarian cancer patients, this is what we most commonly see. But it's sometimes not always very obvious. Sometimes patients can just describe a feeling of heaviness, or even they feel like their skin is tight. And sometimes this is just a decrease in flexibility, a decrease in mobility. Your legs may feel heavier, so things like that. Of course, that's when the swelling just involves the legs, but this can also be in the abdomen and pelvis as well. Sometimes we see skin changes that lie over the area of swelling. This could be dry skin, cracked skin. Sometimes we see redness, things like that. So we sometimes just see those skin changes. And then sometimes patients just note that their clothes just don't fit quite the same. And this is, without any sort of diet modification. Sometimes the signs are just that subtle. So diagnosis is often somewhat difficult. And I bring up recognizing lymphedema because a lot of this starts with patients. A lot of times the patients themselves will bring up these warning signs. But sometimes we do notice it as physicians when we do exams. We can notice a little bit of swelling in the feet and the legs, and sometimes in the abdomen as well. So this is something that we just see clinically during a visit. There unfortunately is not a blood test. There's not any kind of imaging that really diagnoses lymphedema. It's basically just our own assessment. Lymphedema does have a grading system that we don't really use because it doesn't really correlate to the amount of reduction in quality of life. It doesn't correlate to how uncomfortable a patient is. Obviously, the more severe cases are going to definitely be more uncomfortable, but there are some patients who have higher grade lymphedema who aren't quite as bothered by it, and the reverse is true. Sometimes you can have a very mild lymphedema that significantly affects your day-to-day life, kind of similar to the patient I was referring to earlier. But just for completeness sake, grade 1 disease is essentially a less than 20% increase in the circumference of whichever part of the body is involved with the swelling. So, for example, if we were to take a tape measure and measure around your calf, about a 20% increase of the measurement from the baseline would be a grade 1 increase. Now, a lot of times we don't measure patients' legs prior to starting all this treatment. So it's somewhat of an arbitrary grading system as well. And it's hard to be really precise. There are some studies that have looked at this and have measured patients' extremities or measured abdominal circumference pre and post treatment when we're actually tracking this in particular. And grading is sometimes good in an academic sense, but I think in the day-to-day, we don't really use the grading system very frequently. So in the pictures we see here, the two women on the very left, starting left to right, both have grade 1 disease, and then moving up to grade 2 and then grade 3. And obviously you can see it can be very severe. So we're going to start by going over briefly some treatment options that we have once lymphedema is diagnosed. So the first one we're going to start with is prevention, and then move on to early intervention. And then we'll talk about some conservative treatment or some lifestyle management that can sometimes help. And then moving on to more invasive things like physical therapy and then surgical options. So the first thing we need to do is identify what patients are more at risk for developing lymphedema. So prevention always starts in identifying these things. So some risk factors that patients can have that will increase their chances of having lymphedema are obesity, having lower activity levels, prior radiation, as we discussed before, prior surgery, which removed lymph nodes, or any history of any major infection or serious injury. Sometimes infection or injury can sort of wear lymph nodes out in a sense and cause them to become and of course, having surgery, having radiation, actually destroying the lymph nodes and the lymph vessels will increase your risks of having lymphedema in the future. It's always good to limit interventions when necessary. So not to say that we we would withhold treatment for somebody who doesn't have these risk factors. But we want to make sure that we apply the appropriate intervention for the appropriate patient. Some studies have looked at prophylactic compression garments after surgery. This isn't really a widely accepted practice, but certainly the sooner we can act, the better. And these risk factors are more to be in the back of our minds, not only as providers, but for patients to kind of consider these things and educate patients on these things, so that the moment we have any kind of early warning sign, we can then act. So what are some early intervention things that we can do? Again, it starts with recognition, and a lot of times this is recognition by the patient. And taking it a step further, once you recognize this as a patient, it's good to have open lines of communication with your provider, and this is a very, very important step in all of this. But early intervention is typically reserved for more mild cases, kind of like those grade 1 cases that we saw a few slides back. These symptoms can be reversible. Now, although the lymphedema itself is not always completely reversible, sometimes the symptoms themselves can actually be helped a little bit. Early intervention usually means lifestyle modifications and then elastic compression stockings or non-elastic compression leggings. And basically, as we see in this diagram on the right, it's basically just compressing these vessels, and it does a couple things. It doesn't allow as much fluid to escape from the actual blood vessel, and it also kind of compresses those lymphatic channels and helps that fluid go back into the lymphatic system. When shopping for these things, you can actually purchase them on any drugstore type website or Amazon, and a lot of times they'll come with a measure of pressure, and this usually is designated in millimeters of mercury. So this is for this level of intervention, usually a range anywhere from 20 to 60 millimeters of mercury in the pressure range, or in the designated pressure range of the stockings themselves, is most helpful. There are compression stockings that are less compressive, and there's ones that are more, but usually something in this range is perfectly adequate. You also want to be comfortable enough to wear these all day if necessary, or most of the day if necessary. So providing more compression doesn't necessarily mean it's going to help more, because then it'll be uncomfortable to wear. So some lifestyle things that we can look at, again, these are more for mild to moderate cases. Usually the severe cases, unfortunately, don't really respond as well to the lifestyle modifications, but compression therapy, as we just discussed, and going a step further, they should fit properly. And sometimes this is just trial and error if you choose to buy them yourselves. But when we talk about other interventions and physical therapy, a lot of times they can help you fit compression stockings appropriately for your particular case or your particular body. And wearing them consistently is always really important. Unfortunately, this is something that's more of a marathon than a sprint. So it does take a lot of time for these symptoms to resolve, especially when just using the compression stockings. Low impact exercise has been shown to help. So these are just things that don't put a lot of pressure on the joints. So these are things like walking, swimming, yoga. This can help increase circulation, increase some of that reabsorption of fluid back into the lymphatic system. Avoiding overexertion or any prolonged inactivity like standing or long periods of walking is always important, because we always have that gravity kind of working against us. Skin care is important, as I mentioned before. We have a lot of skin changes related to swelling, so making sure using moisturizers, making sure there's not a lot of extreme temperatures, either heat or cold, helps with skin care as well. And then since obesity, unfortunately, is a risk factor for development and progression of lymphedema, having good weight management techniques is always helpful. I'm just going to briefly talk about physical therapy, since we're going to get a much better description in just a few minutes. But physical therapy typically is often written by a physician like myself, from an oncologist or from a gynecologic oncologist. It's a prescription that basically needs to go to an actual physical therapist, even though we're not the ones that do the therapy ourselves. You don't want us to, but any grade of lymphedema can benefit from this, and it's actually one of the most effective treatments that's out there. And I see that not only in the literature, but in my own practice. I've noticed that myself. The downsides are it can be somewhat time intensive. It does take a decent amount of buy-in from the patient, and it can sometimes be costly, but it also depends on your insurance. A lot of times patients are happy to participate. It's something that they enjoy doing, and it's helpful and it works. And most of the time it's covered by most insurances. So the cost is usually related just to transportation or missed work, things like that. Um, the technique is basically with the way that it works. A kind of foundation for how it works is that there's a combination of manual lymphatic drainage that kind of guides fluid to or away from affected areas. So you're basically using other healthy lymphatics to kind of bypass the lymphatics, the areas of the lymphatic system that are damaged. And then specialized bandaging techniques are also important. So this is not only just compression, but an actual wrap and bandaging that can sometimes physical therapists can help with. And then the limb movements that are often involved also stimulate drainage as well, and then reuptake of that fluid back into the lymphatic system. Just to briefly go over a couple of specialty devices, I thought these were somewhat interesting, and sometimes people do ask me about some of these things, especially the intermittent pneumatic compression. So that's the gentleman on the bottom who has these things, and they actually look like they might be enjoyable even after a long day, not just for those who are unfortunately dealing with lymphedema, but basically just they're a series of compressions that start in the feet and move their way up the leg and vice versa, and it just kind of mimics a massage kind of to kind of guide that fluid back to the lymphatics. And then the LymphaTouch system is kind of similar to cupping, if anyone's familiar with that. It's just like a gentle suction that helps transport areas of fluid to other areas, and to go from areas of poor lymphatic drainage to better lymphatic drainage. There is some data on these devices, but they are not great at replacing a good physical therapist. On the more extreme end, we don't typically do this a lot, but in very, very severe cases, there are surgeries that can help with lymphedema. Most of the time, this involves actual lymphatic transplant. So you can transplant an area of lymphatics from healthier areas to the body to the affected areas. There's also very, very highly technical surgical interventions like lymphatic bypasses. So you can actually transplant some of these very tiny lymphatic vessels to bypass the areas that are affected, and even a microsurgery for restoring the vessels, so kind of putting the vessels back together. These are sometimes more isolated cases, and again, these aren't used very frequently. These are very, very severe cases, but there are these options available and out there. These are typically done by a vascular surgeon, and not your oncologic surgeon. Where we do come in handy sometimes, though, is in cases of actual repeat obstructing of the lymphatic vessels. The surgery for treatment is typically the only way that we're involved in that can actually be an intervention for relieving an obstruction. So, again, going back to you as a patient, you're the most important piece of this. So listening to your body and trusting your symptoms are really the most important thing. And then having a good relationship with your provider and speaking with him or her about these symptoms is extremely important. And then being persistent, not only with communication with your providers, but just persistent with whatever prescribed techniques are extremely important when dealing with lymphedema. And again, this is dealing with this is often a long-term thing. It's not unfortunately, there's not a great quick fix to any of this. So persistence in your treatment plan is always really important, and patience, of course, because this, again, is not something that usually resolves quickly, but allowing the treatments to work and allowing some time to go by and some effort as well is really important. And it's not always easy, but important. And then staying informed and proactive in your care, and making sure you discuss with your provider the options that are out there, reading about various things, and asking them. And your provider should be very happy to talk with you about any of these things. So with that, I'll leave some time for questions.
Thank you so much, Dr. Buchanan. And I just put a message in the chat in case anybody wants to see where the chat is. Feel free to unmute and raise your hand to ask any questions, or you can put questions in the chat as well, and we'll read them out. But what a wonderful presentation, and so informative and helpful, I think, too, as well, to hear about the different signs and recognize all the different grades of lymphedema as well. I think seeing how severe we can get at grade 3, but also how we can have this milder grade 1, I think people can definitely appreciate, especially the visuals, to kind of put to understanding, what is lymphedema specifically, and what are we looking for, the warning signs.
Thank you.
Yeah.
I have a question, Dr. Buchanan. I was wondering whether you ever considered or have referred patients for prehab for those high-risk patients.
Yeah, it's
Yeah,
a great
something.
question. The data is somewhat evolving, and the research is actually really challenging for lymphedema. It's hard to measure, it's hard to quantify, and so many patients have different experiences. It's hard to translate that into an actual paper. But in our practice, we haven't really started doing that yet. But I think it's something that we in general need to explore, because it's the sooner the better that we act, and it'll be interesting to see how that develops. But I think that's a great question. It's a great point that, this needs to be something that even if somebody just gets in the habit of going to physical therapy, of doing that ahead of time, it often helps right away. So something we'll have to look at going forward.
We have done some, because, Revital as a national team, we have a whole team, and they've done some research on the benefits of prehab, and I would be happy to share some.
Yeah, that would be
articles
great.
with you. Yep, definitely.
Thank you so much, Rita. And it looks like we have a question in the chat from Bree. Bree said, will it generally be in the leg if pelvic and abdominal lymph nodes are removed, or possibly from lymphedema in the abdomen? And if so, does it look different? Are there different things to look for depending on kind of what area of the body?
It's a great question. And it actually can be all of the above. Often leg swelling comes from removing lymph nodes in the groin, which can sometimes be the case in ovarian cancers. Groin nodes are typically the first place that fluid from the legs drains to, but ultimately it does drain to the lymph nodes in the abdomen and the pelvis. So any of those things could actually result in lymphedema. And then anything different to look for. Lymphedema in general kind of looks the same regardless of what the cause is. So whether it's radiation related or surgery related, or related to a specific type of lymph node, it's the end result is typically the same. That's a great question.
Thank you. And Julie asked in the chat, do you have any current statistics for lymphedema post-treatment?
Again, it's something that's somewhat difficult to measure, and every intervention has a different way that they measure it, and it's hard to gauge. It's really more based on patients' quality of life improvement and more subjective things. But the data is very good, especially for physical therapy. Although I can't quote a specific number, the vast majority of patients at least get some degree of improvement with physical therapy.
Great. Thank you so much. Any other questions for Dr. Buchanan? All right. Well, thank you so much.
Thank
I
you.
appreciate it. And let me just check. It looks like we might have one more question. Julie also said, also a reminder that once PT and OT insurance coverage is used up, massage therapists with a complete decongestive therapy certification do the maintenance work. So a good point to mention. All right. Well, thank you, Dr. Buchanan, and we appreciate your presentation this evening.
Thank you.
Of course. All right. So with that, then we will move into our next speaker. So let me get up here. We have Rita and we have Kelsey from Revital Rehab. All right. So first and foremost, we have Rita Padhiar, DPT, who is the Revital Cancer Program Director for the Southeastern PA Delaware market and a Revital Cancer Specialist. She completed her certification in lymphedema at Norton School of Lymphatics in 2021. She earned a Master of Physical Therapy from the University of Texas in 2000 and went on to get a doctorate in physical therapy from the Temple University in 2013. And then Kelsey Thompson is a Revital certified physical therapist in the North Dallas, Texas area with Baylor Scott and White Institute for Rehabilitation. She earned her Doctor of Physical Therapy degree from Washington University in St. Louis and has focused her career on supporting patients undergoing cancer treatments. Most recently, she achieved her designation of board certified clinical specialist in oncologic physical therapy from the American Physical Therapy Association in 2024. So please join me in welcoming our guests, Rita and Kelsey. Thank you for being here today.
Thank you for having us.
Absolutely. And Rita, did you want to share your slides?
Yep.
Perfect.
Gonna do that. Do you see it clearly? Is all good?
Yes, we can.
Okay, perfect.
All right. So building off of what Dr. Buchanan said, he had a lot of great information, and a lot of that is what we go through with our patients as well, either from a screening side of what to look for lymphedema, or if it's already been diagnosed, how do we treat that and manage it? So we'll go through a few more details on what is lymphedema, different types, what is not lymphedema, risk factors and how to reduce those, and then Rita will discuss how she treats lymphedema in patients. So this is a good slide that again just highlights the pathway of where lymph nodes are and the areas that they drain from. So as you can tell, there is a wide coverage that does reach through the whole body, and the lymph nodes are usually collected at different joints to help filter out. Our main filter, or how it flushes out, is near our diaphragm, so in our abdomens. And our number one suggestion is to work on deep breathing, because we certainly don't do enough as a general population, and it can definitely help reset that system and help flush it out. What you'll see with these tan lines are what is called watersheds, which is where the fluid tends to get stopped. And so what we do for manual lymphatic drainage is to help shift that fluid over to other sides so we can recruit other healthy lymph nodes to aid in the job. So as a reminder, lymphedema is an abnormal chronic collection of lymphatic tissues, lymphatic fluid in the tissues just beneath the skin. It is, along with our blood vessels, it's just other things that don't go through those capillary networks. So there are two different types. There's primary lymphedema, which is genetic or hereditary, or can be due to the abnormal development of the lymphatic system as we grow. And then there is secondary lymphedema, which is acquired damage to the lymphatic system due to surgery or trauma that decreases the body's ability to move fluid out of an area of the body. So most importantly is, when is it lymphedema and when is it not? So swelling is a natural healing part of the journey after surgery or different injuries. So it is not swelling that occurs right after surgery. It is not due to venous system problems. It is not due to water retention. It is not arthritis. It is not other organ problems such as the heart or kidney. It is not due to medication, and it is not due to lipedema. So that after surgery, we do expect some swelling as our body brings in all those healthy cells to help repair what has been worked on, but we want it to resolve within a few weeks. If that swelling is lingering or doesn't seem to be getting better, then that is when we start to look at, is it lymphedema and how do we help that lymphatic system recover? So most of the risk factors are based on research in breast cancer. There really hasn't been as much standardization for lower extremities at this time. But like Dr. Buchanan said, surgery in that area So removing lymph nodes. Right now with breast cancer, it is saying more than 5 lymph nodes does slightly increase the risk. Radiation to the area, which can injure those lymph nodes. A larger BMI, seromas, and post-op infection. So basically when that lymphatic system has to work harder because it is part of our immune system. Other things that we want to look out for is a history of taxane-based chemotherapies, such as Taxol, paclitaxel. Those have a higher chance. Inactivity, because our muscles do help those lymph vessels move fluid through our body. They don't have vessels like our veins, and so being active and moving actually helps provide natural compression to move that fluid out. Signs and symptoms include a progressive onset, so it should be slow and gradual. If you notice a large change in swelling overnight, contact your doctor because that is not normal. Pitting edema is when you press on the skin and it should rebound quickly. If it feels like it stays sunken in, then we think there's a collection of fluid there. Heaviness and achiness, or tension and tightness, so just feeling different, usually on one side more than the other. So that can also look like tight clothing. So socks, shoes, you might notice an indent from those. Decreased definition in bones, joints, and tendons. And then it usually starts at the furthest point away from the body, so most common in toes, and then it will work its way up. These are some great pictures just to kind of show the difference. So like we said, lymphedema is more likely to happen on one side because the lymph nodes were taken from that vessel. The legs will drain up to the groin, the right on the right side, and the left will drain to the left, and then it goes towards the abdomen. So you can see in the hand here that it is much harder to see the joints on her hands. There is some puffiness over the palm and in the wrist as well. And then on the legs, you can see the difference in her kneecap not being as visible. Her toes are a little more swollen and her ankle looks less defined.
All right. Yeah, thank you so much for having us today. And it's our pleasure to actually give a little education. I love doing this talk because this is one of those things, definitely I can say prevention is better than cure. So what to expect? So when you first come to see us, these are some of the things we go through. There is an interview portion where we ask a bunch of questions, and some of them being like, like Dr. Buchanan mentioned, did you have surgery? Did you have radiation? And Kelsey also pointed out like how certain chemos can be a predisposition for lymphedema. So, drugs like taxane. So what was the treatment is very important to note. The other thing we could like to ask is like, what do you feel? Like, so the most common complaints would be, I feel some kind of heaviness, fullness, achiness, maybe even, and sometimes numbness and tingling because some of that fluid might be compressing some of the neurological structures. Where if the patient is often saying there is pain, that's usually not lymphedema. Then we are looking more into something else. Like in the case of breast cancer, we think tendonitis maybe, or maybe just not mobility enough, so the structures are getting really tight, but it's not often described as painful. Then the second component, once we have gathered a thorough history, we also do ask other history just to know the patient's previous level of conditioning. For example, like if the patient has diabetes and obesity and blood pressure, we know that this patient might be more predisposition to lymphedema than the patient who has led a very healthy lifestyle. So the second component part takes me into the measurements. So as Dr. Buchanan mentioned, this is a tricky part, and there are lots of different ways you can be measured. What I commonly do, because I don't have other devices, is actually take circumference measurements. So we start all the way from the foot, and then every 4 centimeters, if we suspect that this is a very the patient can also come to us before they start treatment. Let me just clear that. And actually, that's why I asked the question about prehab. So if they come before they start any kind of treatment and technically don't have lymphedema at that point, it is very easy to identify lymphedema when it develops because we already have a baseline measurement. So we take measurements every 4 centimeters or 10 centimeters. We also measure their overall fitness if they're coming for what we call prehab. We'll have them do like, maybe how many times can they sit to stand in 30 seconds. And we compare that to age-related norms. And here we are seeing that this person is actually pretty good shape. And that will help later on in the game prevent lymphedema. The other thing we do is a walking test. So we do two kinds. For someone who's really deconditioned, I usually go for the tug. And if someone is like looking pretty much in shape, we do a 6-minute walk test. So we'll see how many steps they take in 6 minutes. And again, everything is compared to age-related norms. After gathering all this data, we will prescribe some kind of exercise and what we find. And then the patient undergoes the treatment. And then they come back to us after the treatment. And then again, we kind of go through all of these measurements and we see where they are. So basically, as far as lymphedema would be concerned, we have a volumetric measurement before, and if there is a significant change in the volumetric measurement, we can identify lymphedema very early. Then we go through the staging. So as I'm going to add just one more stage to what Dr. Buchanan mentioned, I'm going to say there are 4 stages. The first stage is subclinical. That means the patient is not really seeing too much. Sometimes they will mention heaviness and fullness. But the way we identify this subclinical patient is the prehab. It's like I've taken all this history. This patient is getting a lot of lymph nodes removed. There is no magic number for lower extremity, but a significant amount. And we know that they got radiation, they had the taxons, they're feeling the fullness. I'm going to identify this patient as stage 0. Again, at Revital, we do have a holistic approach, like I just mentioned. We treat the whole body. We check endurance, strength, weakness, overall function, and of course, the volumetric measurement. After gathering the data, so to speak, we decide on treatment. Now, the treatment for lymphedema is different depending on what stage you are in. So I'm going to go briefly into that. So as I mentioned, there are 4 stages. Stage 4 is reversible. Stage 0, is reversible. What that means is that with elevation, if the patient tells me, I feel a level of fullness, there is no visible swelling because it's stage 0. But you know what? When I elevate my leg in the night, when I wake up in the morning, I feel better. And that means like the fluid is probably gone back where it belongs, and that would be identified as stage 0. Stage 1 is early onset of swelling. This is the patient who says, you know what, when I wake up in the morning, I feel great. But I walked all day, I worked all day, I have not been on my feet, and I see the swelling in certain areas. But then again, when I kind of elevate my leg in the night, I wake up, swelling is gone. So that would be identified as stage 1. So I'll first discuss the treatment for stage 0 and stage 1. So stage 0 treatment and stage 1 is pretty much similar, except one thing, which I'll talk. Stage 0, that means exercise is very, very important because exercise is the best pump you have in your body. Like muscle is the best pump you have in your body. Sorry, not exercise. But just strength, using the muscles will help pump some of the fluid. Self-massage is something we teach our patients, and that is something they can administer on their own, or they can have a loved one do it for them. Again, the technique is you have to see the benefit, because sometimes the massage technique administered with a non-certified therapist can be pretty deep. And this is not a deep massage. This is just a skin stretch, because you just want to activate the receptors so that they can take the fluid back in. Prospective surveillance for the high risk group is like they come regularly and we keep checking them. We develop like a system. Okay, you can come once a month, maybe every month after you have been discharged. And so we just kind of keep looking if there is any swelling. Sometimes when the patient is doing really well, we'll change prospective surveillance to 3 months, 6 months, and you get the idea. And education is also very important. We'll talk a little bit more about that. So this is your stage 1 lymphedema patient. Now the swelling is visible. The only difference would be when they elevate it, the swelling is gone. And in this case, I usually always recommend a compression garment because that is going to be the game changer. Because once they come and we get the fluid contained, it can be by manual massage. You can still do the manual massage or self-massage or with exercise, and you don't have compression to follow it up. The next time you see them, you're going to have the fluid back in. Compression is kind of like sometimes just for heavy duty times. It doesn't have to be all day for the stage 1 lymphedema patients. So if they're on their feet all day, these are the patients I'll say, yeah, that day definitely put on your garment. But you know what? If you're resting, you don't necessarily need the garment. So that's the difference between going into stage 2, which is, so stage 2 is the swelling does not go away. And as Kelsey pointed out, the fingerprint stays. Elevation is not going to reduce it. Symptoms are progressive and irreversible. And when I say this to patients, like it's a chronic irreversible disease at this point, they feel really disheartened, but I want to kind of, emphasize it is manageable. And you will have your quality of life back. So as long as you're compliant with the program, which is, I'll talk in a little bit more. I don't want to give the big away. And then we go into stage 3. The difference between stage 2 and stage 3 is the skin changes. So now the tissue is fibrotic, there are lobules, and so there we are. So you can see now, this is stage 2. There's a circumference difference, as we see. Now, stage 3, if you look here, you can see some skin changes already happening. Also, there are more skin folds. So you can see like this person almost looks like she has bilateral, but you can see here it is, right there. The skin changes are happening. There is more skin folding going on, and that would be classified now, these patients, as stage 3. In case of stage 3, the management is even more difficult. Compression is not only in the daytime, but also nighttime garments are highly recommended. In fact, stage 2 would also benefit from nighttime garments. So what is the treatment for stage 2 and stage 3? This is the tada, is complete decongestive therapy. So there are 4 components: manual lymph drainage, compression therapy, skincare, and exercise. We'll go a little bit into it. All right. So this is the manual lymph drainage. It is done by a certified therapist. I want to emphasize stage 2 and stage 3 should be only treated by a certified therapist. And for stage 0 and stage 1, as you see, at least at Revital, all our therapists are very well trained to manage stage 0 and stage 1. So when you inquire where you should go, please kindly ask if they are certified, because that's extremely important. So we start the treatment with manual lymph drainage. We usually start in little segments. You'll do the foot first, and then actually you don't do the foot first. You actually activate the central system, which starts from the neck, abdomen, diaphragmatic breathing, activate the inguinal nodes, and then you treat in segments. So we treat the thigh, and then you go to the lower half, and then to the ankle and foot. So, and that just kind of shows you the pattern. And usually you want to do it without clothing, just underwear. You don't want any clothing, because what manual lymph drainage is, it's a skin stretch, and you cannot stretch the skin with clothing on. So it's very important that this not be the scenario, actually. The best compression is bandaging. There is so much research out there. That is because bandaging has a short stretch. That means it has a better working pressure. So when you're walking and all that, you're not going to have that little folds, or the bandaging get into the creases, but you can see how uniform it looks. Whereas if you use any other kind of compression over the counter, there is going to be creases and stuff, and then fluid will accumulate in those areas. So bandaging is nice and uniform. And also we can break down fibrotic tissues by using foams and other methods. And this is just an example of bandaging. Extremely good over-the-counter compression garments are available nowadays. And what you want is for stage 2 and 3 is short stretch compression, which is what this wrapping is showing you. I would not only go with this, because if you only go up to this point, I guarantee you there is going to be fluid buildup in the foot. So definitely I would go, if they have only fluid from the knee down, then I would go up to this point, but otherwise the full leg compression is the best idea. But this is just to give you an idea. And then we follow that with exercise. So it's basically just moving each joint, like Dr. Buchanan mentioned, like ankle pumps, and you can do some heel raises. So each joint, just go through each joint. I usually say 10 times. So start with the ankle, go to the knee, right? Knee extensions, your little marching action, and a little bending of the knees, and some squatting. So go through each and every body part and start moving it, basically. Sometimes I make the patients do some of these exercise lying down with their foot elevated, because remember, elevation helps the fluid go back to the heart. All right. Skincare, extremely important. I think Dr. Buchanan touched on some of them, but I'm just going to quickly go over. Remember, you do not want any kind of infection or inflammation, either or, because that builds up fluid. So insect repellents to prevent insect bites. Again, that can cause infection if the skin is open, that's why. Chafing can cause, in winters, can cause, again, open skin. We don't want that because that increases infection. So moisturizing with a lotion, which is low pH and no alcohol, is the best option. So again, sunscreen would lead to open skin, and we don't want that. So high SPF to prevent sunburns. We want to prevent fungal infection, so using an antifungal powder, cutting your nails with nail clippers. Footwear is extremely important, but you don't want to have your toes bare, wear sandals, especially if you're walking in grass, because again, you can get bites and something can hurt you, and then again, you are more prone to infections. Using an electric razor for the same reason, you don't want a sharp razor blade cutting your skin open. And not wearing tight-fitting clothes, wearing loose-fitting clothes, so that there is no constriction going on anywhere. And these are some of the resources we have. And we are going to share all these resources with you guys. But I feel like at this point, I spoke so fast, so want to leave some room for questions.
Thank you so much, Rita. And Kelsey also put in the chat, for anybody who didn't see, a questionnaire that they use to help identify how lymphedema is impacting quality of life. So definitely take a look at that if you haven't had the chance to look. Does anybody have any questions for either Rita or Kelsey? I think what a wonderful presentation too, and very thorough as far as these steps for management as well. And great to acknowledge too, seeking out that certified care as well. I think that's so important to highlight as well, making sure we're seeking a qualified professional for support. And Rita also put the Revital Rehab website into the chat for everybody. So thank you very much for that, Rita. All right. Any questions from anyone? You can feel free to unmute and ask. I don't think there are any questions. It doesn't look like any questions. However, certainly Rita's email is in the chat as well. Feel free to reach out with any questions that you have as well. We can put you in touch with any of the speakers to ask any questions, especially thinking about, learning about all of these topics with lymphedema and self-management, looking for recommendations and also recommendations for care as well. We'd love to put you in touch. So we appreciate you so much. Yes.
I have a question. I apologize for this. I'm having an issue trying to copy the links.
Okay.
Are you all going to send a follow-up email with what was put in the chat?
Yeah, absolutely. I will send it to Aubrey and Aaron, and they will share with everyone our website. And so once, just a little,
Okay.
again, whenever you're going for therapy, make sure you're going to a certified lymphedema therapist. And even if you don't have lymphedema, my advice is always ask for a cancer specialist, because not every therapist can be certified. I understand lymphedema is like, you can fill a room with lymphedema therapists. we don't have that many around, especially in the PA market. So, any of our certified therapists or any therapist or specialist in oncology, doesn't have to be with us. Make sure you go to them, because I, coming from an orthopedic background and going into cancer rehab, I can be very honest and open with you guys. I did things very differently. And once I got certified, I realized I would not want any of my loved ones to go to an orthopedic therapist just for those reasons, because we are very good with understanding what not to do versus what to do. And if you go on our website, which is www.revitalcancerrehab.com, and you click on locations and put in your zip code, it will show you where our locations are. But we will send all the information for sure.
Thank you. Yes, and I will share out too, especially this slide that has all of the resources that you mentioned in it, so that everybody has access to all of those.
Thank you so much.
And I'll add too, from a provider standpoint, when we write a prescription for physical therapy, you don't necessarily have to go to a Jefferson affiliated physical therapist, a Fox Chase, a Penn, whatever. Most, and correct me if I'm wrong, Rita and Kelsey, but most, your center will accept prescriptions from any physician. So all we need to do is write a general script, and then you can take that, correct?
That is correct.
Yeah.
And also, the way we work is actually we have a central scheduling number. So once, I'll talk to Dr. Buchanan later, but once you fax the prescription, we actually verify the insurance. So you always know what you're getting into. And then we've tried to find the nearest location for you guys. So then you'll be scheduled accordingly. Very few insurance Novacare does not accept. And I do want to touch on that and the cost. So there is some really good news in 2024 that a lot of the garments are now covered. So there used to be a time where you guys had to buy all the garments, but from January 2024 for Medicare, I think it is 4 garments per body part. And so there is that's just, we have been lobbying for this forever. So the other thing is, a lot of the deductible plan with all the treatments with Dr. Buchanan and other doctors, radiation therapy and whatnot, most of you have already met your deductible. So really, we can work around you. And there is always financial aid with every place. Even we have we do waive copays if there is a patient who can show their tax returns and we find that if they cannot afford therapy, we would waive their copays at that point or set up a payment plan.
Great, thank you. And Julie in the chat said, especially with massage therapists as well, keeping that in mind, going with a certified lymphatic therapist with over 90 to 160 hours of training. There are so many weekend or week-long trainings that say they are certified, but haven't done enough training. So I think that's a great point to make as well, too. That is
very true. I think my training was 130 hours, something insane, really. So yeah, if going with a certified Norton, Close, you can even ask them, and I would be happy to help out. It doesn't matter, you don't have to go with me, but I would be happy to help out with you guys to see if it's a good lymphatic school. Wonderful. Well, thank you so much, everyone, for attending. Thank you, Rita, Kelsey, Tommy as well. We really appreciate your time today. And thank you, everybody, for attending and watching her speaker series. Thank you for these wonderful presentations. And of course, I would be remiss if I didn't highlight our digital education events are presented by West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, Gilead, Pfizer, and ImmunoGen, now part of AbbVie. As a reminder, we'll be kicking off October with our Her Speaker series next Thursday, October 3rd at 6 p.m. via Zoom with Touch BBCA, and you can register on the Unite for Her website or on social media. So thank you again, everybody, for attending. We appreciate you joining us today, and we look forward to seeing you at one of our next events. So everybody have a wonderful evening.